Hey everybody, it's Matt Shu from Upright Health. Today I wanted to talk with you really quickly about chronic pain. There's an idea that's gaining a lot of popularity that I think can actually be a little bit dangerous for people who are in chronic pain because it's a very disempowering idea. The idea is that chronic pain, basically pain that's been persistent for longer than depending on who's defining it, longer than 3 to 6 months without any sign of actual damage, is in fact the product of either nervous system malfunction, so something going on anywhere in the chain. Let's say I have chronic ankle pain. The theory would be that it's due to some dysfunction along the nerves that are serving that, possibly within the receptors, possibly within my brain, that parts of my nervous system are basically misfiring and giving me bad information and telling me that something is wrong. Unspoken assumption in this theory is that we have the technology and the full understanding of what damage looks like and what proper function of the nervous system is. And I think that's actually not a safe assumption based on the state of medical science for lots of different kinds of musculoskeletal issues. I think it's wildly premature to say that we really understand how everything works and that we can say, well, yeah, if you're experiencing pain, it's because your nervous system is broken. Or in some way miscalibrated. I think one actual client case that we had here this week will be really illustrative of this problem. We assume that we can see all kinds of tissue damage and we can see all the pain generators, that we have the tools necessary to image and find and discover what's really causing problems. That belief is widespread, right? We believe in X-rays, MRIs, CT scans, all these things can identify pain generators. But study after study shows that they can't. In fact, what we generally find is that those images, X-rays, MRIs, CT scans, will show us a lot of stuff that looks wrong, right? We'll see it in spines, we'll see it in knees, see it in hips, and say, well, that looks wrong, that must be the pain generator. That's the thing that's causing your problem. And what is found very consistently is that the things you find in those MRIs, X-rays, CT scans, they actually don't appear to have any relationship to actual symptoms. So we're seeing a bunch of stuff, but it's not stuff that's actually relevant to the experience of pain, which then leads you often to this idea that, well, it's actually probably just your nervous system. I think what's missing in that discussion is an understanding of proper mechanics and understanding that the way muscles work together or don't work together can also greatly affect your comfort level. I don't believe that there's a very easy way to measure the difference between one muscle and another muscle, except for the use of different and varied exercises in order to gauge what one muscle can do versus another. I don't think it's particularly useful or comfortable to do any sort of electrode testing or doing maximum voluntary contraction testing. Seems like it would be wildly time inefficient and expensive, but in general there are ways to make sure that muscles are working, and that's by testing different exercises. So the example that I want to give you is actually of somebody who flew here from New York actually recently, and she had been having hip and back problems for quite a while. I don't remember exactly how long, but she herself is a physician, went to a bunch of different doctors and specialists, a bunch of different physical therapists to try to get to the bottom of her hip discomfort and her back pain. And so what she was told was, well, we think it's from your back, and we think your back is causing your hip pain, and you need to do core exercises and maybe some bridges, right? Now the thing is, throughout all this, things didn't get better, right? And there also wasn't any actual experimentation with what muscles should and should not have been doing. So she went through this whole long period of time with a bunch of pain, and the pain just getting worse and worse, worse and worse and worse, until she actually decided to fly all the way out to Redwood City, out to the San Francisco Bay Area to come see us and see if we could figure out what was going on with her. And for her, the problem was something that's actually fairly common that we see, and basically her hips were a little bit too tight in one area and really weak in another area. And nobody had been able to coach her to use the right muscles properly to stabilize the hip, which then reduced the strain that was going up into her back, right? So the thing that we're doing here that's different, and the thing that I think is really important for people who have chronic pain, is that you look at what muscles are doing in a global way, right? If you see somebody who is walking and moving and standing in a funny way, you want to be thinking about what muscles are causing that. What are the muscles that are not doing their jobs well enough to give you the stability to maintain the right position while you're moving? In a medical environment, I know that that's really difficult. Most doctors don't have the time, nor have they had the training to really examine musculoskeletal issues. We have other clients who are physicians in related medical fields, and what we consistently hear is that real good training on how somebody is supposed to move just doesn't exist in medical school. It's just not something that's generally talked about. So we've actually recently put up a video series for medical professionals in case you want to watch that video series to help you with certain movement patterns and different ideas for your patients in case you are a medical professional. But in any case, the issues that you run into muscles are varied. You can have weakness that needs to be dealt with over time. You could have tightness and weakness together where you're needing to stretch something and strengthen it in order to restore proper joint mechanics. You could have something that's just way too strong, right? A lot of times I talk about this, the quads being a big contributor to back problems, hip problems, right? You can have this imbalance throwing things off that can be trained away if you're taking the time to do it and if you're doing it in the right way. But that's not something that's generally tested. 12 weeks often for some, well, not often, but for some things is not enough time, and that's usually the limit on somebody's physical therapy insurance benefits. So when you're thinking about dealing with muscles, you have to take a longer view than what's normally allowed within our current medical treatment system. And you have to be willing to experiment and be wrong. It literally took me forever. It didn't literally take me forever. It figuratively took me forever to figure out what muscles needed to be worked on to help my body feel better. I would spend hours in front of the TV doing different exercises and different stretches trying to figure out how to get my hips to loosen up just based on different theories. Maybe it's because my butt's too small and too weak. Maybe I gotta make that stronger. Maybe the front of my hip is just too tight. Maybe that's what's making my butt weak. Those things actually dovetailed and they worked, right? And we find that for most people, if you're willing to take the time to experiment and to gradually make changes to see what happens, you end up finding the real causes of your problems. It just takes time, and it takes a lot of dedication, and it takes some perseverance. But when weighed against the option of here's a pain pill, or here's a surgery that we think will help, it can be really hard to say, yes, I'm willing to take this long path. But I really do strongly believe it is the smarter solution. The pills, I think a lot of people are starting to realize, a lot of medical professionals are actually talking about this now. The pills can be addictive, and that in itself is problematic. And the surgeries, the whole history of surgeries for different musculoskeletal issues is not really that great. And I think if you want to do the research on that, you will find that it is not generally a guaranteed thing that you're going to get relief from a surgery. Where those things promise to be quick relief, the long path gives you a different sense of power, right? It gives you the ability to control your comfort level and to understand what your body needs to feel good. And that's ultimately something that we here at Upright Health really want to convey. If you put in the time, you put in the effort, you learn what your body is supposed to do, how it's supposed to move, what it's supposed to feel like, you can make huge improvements to your own life, to your own pain levels, to everything. So that's my little tirade, my little rant, my little talk on chronic pain. I hope that it gives you some good ideas, and I really hope that you remember that pain sucks, life shouldn't.